All right, let's get right into it. We need to talk about a huge, and I mean huge, change that's coming for millions of Americans who get their health insurance through the Affordable Care Act marketplace. Think of it as a financial cliff, and it's set to hit in 2026. So, if you're one of the 24 million people out there with an ACA plan right now, you're going to want to listen closely. Because what you pay, the kind of coverage you get, and maybe even whether you can afford to stay insured at all, well, it's all about to change. And I'm not talking about a little bump here. This isn't your typical annual price hike. We are looking at a sudden, massive price shock that could seriously reshape household budgets all across the country. Yeah, look at that number. It's pretty staggering, right? A KFF analysis found that if a key government policy is allowed to expire, the average subsidized enrollee will see their premium payments more than double. That is a 114% jump. So let's break down what the sticker shock is actually going to look like for real families. This isn't just some abstract economic forecast. This is about the actual dollars and cents on your monthly bills. Let's use a real-world example here. Imagine a 60-year-old couple. They're making about $85,000 a year. Right now, their premium is capped. It's manageable at 8.5% of their income. But come 2026, that could leap to almost a quarter of their entire income. For the exact same plan. That's an extra $22,000 a year. Just poof, gone.
So why? Why is this happening all of a sudden? Well, it's not just inflation run wild. It all boils down to a temporary discount that is about to vanish. Let's peel back the curtain on the policy behind that price tag.
The magic words here are enhanced premium tax credits. The easiest way to think about them is like a massive government-funded coupon. It was rolled out back in 2021 to make insurance more affordable during the pandemic, and it slashed premiums for pretty much everyone on the marketplace. And this timeline really tells the whole story. These credits were never meant to be permanent. They were passed in 2021, they got a one-time extension in 2022, but they were always designed to expire at the end of 2025. And now, well, the clock is ticking. You know, the impact here goes way beyond just a higher monthly bill. This price shock is going to create a ripple effect that could actually push millions of people out of the healthcare system altogether. And here's a number to back that up. Research from the Urban Institute predicts that if these subsidies expire, 4.8 million people will become uninsured in 2026. That's a 21% jump in the uninsured population, basically wiping out years of progress in getting people covered. And behind that huge number are real people facing just impossible choices. This quote from Ms. Reed, an ACA enrollee, just captures that anxiety perfectly. She's thinking about switching to a plan with a higher deductible to save money, but she calls it what it is, a gamble against a potentially life-altering hospital bill. And this is so crucial to understand. This isn't just about your monthly premium. The total amount of money you could be on the hook for is also going up. The maximum out-of-pocket cost for just one person is projected to hit $10,600 in 2026. That's how much you have to pay before your insurance even starts to cover everything. So what are people going to do? A KFF poll gives us a pretty clear picture of the tough decisions ahead. A third of people say they'll hunt for a cheaper plan, which probably means worse coverage. And a full quarter, 1 in 4, say they'll likely just drop their coverage completely and risk going uninsured. Now, for those who do try to find a cheaper plan, the marketplace can be a seriously confusing puzzle, especially when you start trying to figure out these so-called metal tiers. So the basic idea is supposed to be a simple trade-off, right? Bronze plans have a low monthly cost, but you pay a ton when you actually get sick. Gold plans are the opposite. High monthly bill, but lower costs when you need care. And silver is somewhere in the middle. Simple enough. Or is it? Well, as this Reddit user found out, the math can be completely backwards. Because of how the subsidies are calculated, sometimes you can find a gold plan with much better coverage that has a lower monthly premium than a silver plan. It's wild. It forces you to become a spreadsheet wizard just to avoid getting ripped off. But hold on, there's another critical layer to this whole thing. The pain from these price hikes will not be felt equally across the country. Where you live is going to have a massive impact on how much your insurance bill goes up. A MoneyGeek analysis found that, on average, gross premiums are set to jump by about 20% nationally, and that's before any subsidies are even considered. But that national average It hides some absolutely wild differences from state to state. Just take a look at this. In Arkansas, unsubsidized premiums could soar by nearly 67%. New Mexico, over 50%. Meanwhile, you've got states like New York and Alaska where the increases are in the single digits or even going down. It's a huge disparity.
And this gets to one of the key reasons why: state-level policy choices. On average, the states that expanded their Medicaid programs saw premium growth that was 8 percentage points lower than states that didn't. It seems a healthier overall insurance pool just helps keep costs down for everybody.
So let's pull all this together. What we're really looking at is a perfect storm: expiring subsidies, rising premiums, and increasing out-of-pocket costs, all converging to create a massive affordability crisis. So, if you remember anything from this, remember these 4 things. 1, a policy cliff is coming in 2026 and it's going to be a shock. 2, this isn't just about higher bills. Nearly 5 million people could lose their coverage completely. 3, your total financial risk is going up too, with higher out-of-pocket maximums. And 4, your zip code is a huge factor in how hard this is going to hit you.
This quote from Dr. Littman, who's actually a chiropractor and uses an ACA plan himself, just sums up the reality for so many people. With deductibles so high, you don't really feel like you have insurance for a checkup or a minor cold. You have insurance for the catastrophic $10,000 bill. And all of this leaves us with one big, unavoidable question. As millions of people are about to be asked to pay so much more for plans that cover less and less of their day-to-day needs, what does affordable care even mean anymore?